Hi guys, Prab and Leki here from ProPhysio Plus today. I'm going to be talking about inflammation and inflammatory pain to be more specific and why this is important for you. Please like the video, subscribe to our channel, share with your friends. All right, let's jump on in.
So what are the 5 classical signs of inflammation? Really quick easy things to look out for. Number 1, you look for pain. 2 is heat. 3 is redness. 4 is swelling. And 5 is loss of function. Okay guys, one of the elements of when you go see a physiotherapist is a subjective assessment. Simply said, Q's and A's, questions and answers. Now, a lot of your story on how you become injured is very important to us because we can help map your recovery from an injury. Now, there is a graph here that is going to be right next to me here, and this is a graph of phases of tissue healing. So, bones will heal differently to tendons, which will heal differently to ligaments in terms of wound healing, and inflammation, which is a normal part of this process, plays a massive role. So that's why we can expect bones to sometimes take weeks to months, tendons sometimes months to years, and ligaments and muscles to be days to weeks. Okay, so the subjective assessment, a very important integral part of your treatment, is to understand your story so we can help fast track your goals. Okay guys, Prab's going to help us with some top questions that we find either in the clinic or on Google. Here's question number 1. Prab, what is the main cause of inflammation in the body?
Great question, Leki. We hear a lot of patients ask this question all the time. So, the main cause is the arrival of blood products at damaged tissue site allows the body to prepare for the healing process. White blood cells, specifically leukocytes, big word I know, but don't worry, infiltrate the damaged tissue and consume debris and dead tissue in a process called phagocytosis. Once the damaged tissue is removed, the remaining tissue is prepared for rebuilding and the damaged cells no longer produce inflammatory chemicals, slowing down the whole inflammatory process. So when damaged tissue is unable to be completely cleared or removed from the damaged site, inflammation continues to cycle without stopping. This is called chronic inflammation. The normal process of inflammation spans between minutes following damage and the next 72 hours post-injury.
That's right. So think of Pac-Man. Pac-Man's running around trying to gobble up some of the debris. Question number 2. How do you get rid of inflammation?
Second question we always get, how do you get rid of it, of course? In the last stages of inflammation, special cells called fibroblasts begin to rapidly multiply in and around the damaged tissues in a process called proliferation. Remember that model again? It's the stage 2. Fibroblasts reconstruct damaged blood vessels in the area and lay down bundles of collagen to rebuild the damaged tissues around the damaged sites. This may include surrounding muscle, connective, epithelial tissues that were also damaged by the abnormal load causing that tissue breakdown. Once the immature tissue is laid down, the wound begins to contract to reduce the size of the damaged site, and this begins on the first day of the injury and extends up to a month post-injury.
So there you go, guys. That's why it's important to get the advice and the feedback from your subjective assessment from your local physiotherapist. Question 3. What is the strongest anti-inflammatory?
Very good question. Leki, what is the magic pill to solve your problems? This is a big question because there are many ways to answer this question, first of all. From a conservative perspective, the best and long-lasting measure for reducing inflammation is allowing the natural process to come to a natural end. Conservative healing time frame, guys. So this comes down to the specific tissue wound healing. Muscles, ligaments, tendons, nerves, discs, and all human tissue have a specific healing time frame. Some may take seconds and minutes and others, hours and days, but most are in weeks and months. So my best recommendation for anti-inflammatory effects is check out our Peace and Love blog post. We've already outlined it of what you guys can do to help yourselves as well. So it houses everything you need to know, and check it out.
Yeah, shout out to Avi for that blog post. Question number 4. Why is inflammation worse in the morning, Prab?
Great question. That aches and stuff you feel straight in the morning, let's get that answer done for that question. Morning pain is one of the classical signs associated with inflammation and inflammatory conditions such as rheumatoid arthritis. So patients frequently come over to a clinic and they present with this if they have an inflammatory condition and always ask this question. Simply, the reason why this happened is due to the fact that at night, your body is trying to recover and releases anti-inflammatory chemicals to reduce pain and stiffness. However, by the morning, the body is no longer able to fight the chemicals causing inflammation and resultantly, the pain is at its worst. Therefore, having a good sleep schedule and a healthy circadian rhythm is one of the best things you can do to manage inflammatory pain.
Good sleep, guys. Get it while you can. Question number 5. What can I take to reduce inflammation, Prab?
So, along with that magic pill and a little description we had at the moment, here are some little steps that you can try. And as mentioned before, inflammation is multifactorial. So again, there's no one way, there's no magic bullet, there's no magic pill that you can take to magically remove everything. If not, we won't be here working today. So however, there are bodies of evidence and research that back up the benefits of certain dietary changes, food and medicine consumptions that can aid with inflammation. As always, please make sure you consult with a relevant medical professional before undertaking any changes or consuming any products. So first of all, avoiding certain foods, refined carbs, fried foods, processed meats, all these foods have been linked to increases in inflammation. Second, anti-inflammatory medications and consuming more anti-inflammatory linked foods such as leafy green vegetables, fatty foods, olive oil. All these foods are high in things what we call antioxidants and polyphenols, which are shown to reduce inflammation in the body. And lastly, adopting diets such as the Mediterranean diet or utilizing FODMAP for certain conditions. We have mentioned that in the past as well, so please go and check out our previous blog posts. Are very, very beneficial. So there you go, guys, some steps that you can try and take in your own lives.
Great, guys. So there's the summary there. Inflammation is a massive, massive topic. We've tried to distill it down for the more acute inflammation, and hopefully you found a lot of value in this post today. Check out the blog post that accompanies this video, and if you need us, please find us online, and we'll see you soon.
So there you have it. We've laid out how you can benefit from everything that we've spoken about inflammatory pain if you're experiencing it. So please do let us know how you went with it all. Please like the video, subscribe to our channel, and share it with your friends, and we'll talk to you again soon. Making healthy simple, ProPhysio Plus.